go ahead and ask Nick to introduce himself and our speakers today.
Thank you, Jaquidra, and thank you to IABC for hosting this great event and for allowing us to partner with you. We're very excited whenever we can get a large group of professional communicators together to talk about anything and then to begin solving problems. So it's great to be with everybody who's on this call. It also included on today's call, along with the members of the IABC Greater Cincinnati, are a group of a number of CMOs and CCOs from various organizations with whom we, Vehr Communications, regularly interact to discuss marketing and communication issues. We call it our Caffeinated Connections group because we typically meet at 7:30 right after everyone's first cup of coffee. So a little bit about our panel today. I'll be the moderator. I'm Nick Vehr. I'm the CEO of Vehr Communications. On our panel will be Laura Phillips. Laura is our president at Vehr Communications. She's president and counselor. Laura and I have worked together at Vehr Communications and another agency for more than 20 years. And that qualifies me to share with you that she is way smarter than I am and than I ever was or ever could be. And she is typically on point for most of our large and most complex clients. And then also Dr. Angelica Hardy. Dr. Hardy is the Vice President of Health Strategies for the American Heart Association. She received her bachelor's, master's, and doctorate at the University of Cincinnati studying public health, health policy, and global health systems. She is what public policy experts, like Dr. Fauci and those guys, she is what they would call a health equity leader. She serves on a number of local organizations, including the Urban League of Greater Southwestern Ohio and the board of the Cancer Justice Network, UC Community Advisory Board, St. Aloysius, and many, many others. And so we're really, really glad that Dr. Hardy is with us today. So as Jaquidra said, we're going to have a moderated discussion on the important and very complex issue of vaccine communication in the workplace. The discussion will focus on what COVID taught us about internal comms, and as a whole bunch of internal communication specialists on this call from the IABC and from our group, the Caffeinated Connection groups, we're gonna talk about it from that perspective, what we learned from COVID. We're gonna try to point you all and share with you timely and relevant vaccine insight, updates, and resources. And then in particular, Dr. Hardy is going to share perspectives on vaccine public education, especially in minority communities, the Black and Latinx communities. Just something, just to get our heads in the same place, something to keep in mind during this morning's presentation. And that is that there's a difference between vaccine information and vaccine education. It's really important as professional communicators. There's lots of information out there, but whether or not the vaccine is successful and we reach herd immunity as a society, and we start getting on the downward slope in the back end of this bad boy and back into working the way we all are used to working, whatever that new normal is, it's going to take a lot of vaccine education because there are certainly concerns out there, but also misinformation and disinformation. So remember that there's a difference between vaccine information and vaccine education. So if we're successful today, we'll share and then also point you guys to all the attendees to vaccine information so that you can decide how to address vaccine education in your own workplace. So now what I'd love to do is I'd love to turn it over to Laura Phillips. Again, Laura is the president of Vehr Communications, my colleague, and she has been on point for an awful lot of the in particular, COVID-related work that we've been doing on behalf of a number of clients. So Laura, it's over to you.
Thanks, Nick. So as Nick mentioned, I'm going to talk a bit about communication in the workplace. And while it's always been a necessary function within organizations, this past year has really emphasized that it needs to be a critical organizational priority. And we're finding that this too will be the case when it comes to vaccine communications. So we faced such intense, widespread challenges in 2020. So I'm going to touch on some of the learnings that came out of COVID and how they are influencing our work going forward. But I'm going to talk about them through some of the core best practices of internal communications and issues management, because the foundational tenets of our jobs have not changed. So the first one, accuracy and honesty is paramount. This has always been true, but when the stakes are high, corporate communications take on a new level of importance. In 2020, companies had to address their employees' most basic needs of safety, stability, and security. And employees have been turning to their employers for guidance and insight and for credible information throughout the pandemic. Not sure many of you saw the Wall Street Journal article just this past week, but they compiled some stories of companies that are stepping up their roles in disseminating public health information. And let's be clear, they're not simply passing along vaccine distribution information, they're taking on vaccine education. As Nick mentioned, there's a difference between information and education, but they're trying to do their part to combat skepticism. And it's interesting because public health was not in scope for corporate communicators before 2020. But people are placing more trust in their employers than they are in the media, than they are in social media, and they are in their government. And that's a pretty heavy responsibility, especially when employers don't have all of the answers. And that's okay. We're not doctors or scientists, so we must continue to lean on the experts. But as professional communicators, we cannot discount our roles in being trusted messengers. Another core best practice, communications must be consistent and professional. So COVID-19 has made some companies acutely aware that their internal communications mechanisms need attention, whether their infrastructure was antiquated or just not conducive to efficient connectivity with a remote workforce. So this past year has reinforced the need to invest in this area. And I think many companies have been guilty of viewing internal communications almost as secondary. It was viewed as a necessary function, but not necessarily a strategic component of business. And COVID has made companies realize that just because you're talking with employees doesn't make it less important or impactful. It has never been clearer that maintaining a knowledgeable and engaged workforce is essential for productivity, for innovation, to maintain a culture while you're all out of the office, and so much more. It's one of the most important jobs that a leader can have, which is likely why we've seen more corporate CEOs this past year speaking out and engaging with stakeholders. The next tenet, preparedness is crucial. This has always been the name of the game for crisis communications. You identify the areas of vulnerability based on the type of industry you're in, the areas of exposure specific to your business, and you throw in general crisis scenarios like a data breach or leadership transition. And so doing this exercise has always challenged us to think ahead, to explore the what ifs and think through processes and positioning strategies and messaging. And it's really just a best practice so that you're not starting from scratch while you're in the throes of a crisis and the world feels like it's crumbling around you. And while I'd venture to say that most companies did not have a global pandemic in their crisis response plan, COVID-19 has enlightened even those companies who have never done crisis preparedness before, that it's a worthy discipline to go through. And I think we really all practiced this past year because the extended length of the pandemic has gotten everyone into this mindset. Usually when you're doing corporate communications and you face a crisis, the crisis has a shorter duration. This has been an extended crisis for all of us. So back in March and April, we were discussing protocols for employee exposure, implementation of new health and safety practices, communication needs for when employees get sick, or heaven forbid, if we have an employee death due to COVID. But as the year progressed, we were forced to look ahead and say, we're going to have to communicate around return to work. Many on this call likely had to prepare communications about your company's financial performance. So we're all on this call today because companies are now questioning their roles when it comes to vaccine communications. And what do we need to do to be prepared? Can we mandate that employees get vaccinated? Should we advocate for it? Some companies are incentivizing employees. Really, we're all just figuring out what is our company's role. Another foundational tenet is being nimble. The most successful communications leaders must be able to pivot. Information and circumstances change, and you must be ready to modify your strategy. And I know many on this call had this quality tested over and over again this last year. And finally, the one I want to hit on is really the crux of our call today. You need to understand your audience's perspectives. All on this call know that our jobs are not simply to push information to various stakeholders. Our jobs start with listening, learning, and understanding the concerns and priorities of our audiences. We then use this insight to be stronger, more thoughtful, and empathetic communicators. This aspect of our jobs has never been more difficult than we've had it this past year, but we're all finding that we're not out of the woods just because it's 2021. I know one of my biggest learnings as a professional communicator was that the communications we craft, what we say, and what is heard by our various audiences may completely diverge. So it's important to invite more and different perspectives to weigh in, especially when it's communications of consequence. And this is great communications of consequence. So we're about to hear from Dr. Angelica Hardy as she provides some context on why a cookie cutter, one size fits all approach to vaccine communications will not work.
Thank you for those intros. You mentioned Dr. Fauci, and I just like fangirled a little bit because if you think about the last year, that has been probably one of my most trusted leaders, as well as many others, and within my organization, as well as us as a nation, as well as the global leaders within when we think about COVID. It has been a trying year, and when you were saying that, I was thinking, oh man, it's been a really hard year for public health too. I laugh with my family and friends because no one knew what I did before 2020. I don't think they really understood what public health was. So when we think about public health and business, I totally felt that when I see myself a lot more involved in different things than I had before. But it has been a trying year, but I think a really, really pivotal year for us to start thinking differently about our health. So specific to COVID, we know we have a lot of information. We do not have trusted resources, or we do, but we don't send people to trusted resources. I laugh a lot when we think about, I call them Facebook doctors. Everyone on social media has become a public health professional, an epidemiologist, a data analyst, et cetera. And often we are not really getting trusted information, and or we're also seeking one person's experience as all things. So when we think about a vaccine, there was just so much distrust, and I'll talk about within minority communities in a second, but overall, when it came from the public health field, and Laura mentioned the distrust that came from both federal governments and us not being united when we think about how we took the approach to COVID-19, us having different things in Ohio in comparison to Kentucky, in comparison to Indiana. And interesting enough, we're all in this tri-state region. So we think about that, and those are the opinions or things we have to take into account when we're communicating to others. And as public health communicators, we have really made sure that we use the right language when it comes to communicating about this vaccine. I think we were talking about a vaccine before, when it was still up at Pfizer and Moderna being thought about. We were kind of already starting distrust with the vaccine and the communication then. So here we are, 9 months later, we are now administering the vaccine, and we really haven't addressed the mistrust and distrust that was happening prior. So it's really important to think about the history of COVID, even in this short history that we are a part of, but take all of that into consideration and understanding where people are coming from when they have those communication needs. So thinking about focusing on having medical experts as the trusted voice, utilizing the research, utilizing things like this is safe for yourself and your family. We've realized the core values in this last year, as we've had to be home, our core values are protecting ourselves and our families. I know one thing that as public health professionals, we often use the word community and population. And we actually saw that a lot of times people, for lack of a better word, even though we believe people are egalitarians and like don't want to harm others, they're really, really worried about themselves and their own families, which is the communication style we want to use when we're talking about the vaccine. You're not only protecting yourself, but you're protecting your family as well. You're getting the vaccine to keep each other safe. Safe is the most important part of that. making sure we're calling it a vaccination and not an injection. So just being very mindful of the words that we use, and then focusing on things like returning to normal, as Nick mentioned, and things of that nature. So, and on top of communicating about the vaccine and the importance of the words that we use, we also have to continue to talk about social distancing and wearing masks. So vaccinations are just the first step to us reaching herd immunity. I would love to reach herd immunity. I am really excited about that because we personally, or at least me personally, I've never experienced it in my lifetime. I have benefited from it, but I have never actually been through a time we're experiencing herd immunity in the pandemic, because it's my first one. Hopefully my last as well. But when we think about the vaccinations, we have to think about vaccine and then continue to social distance until we wear masks. I know Dr. Fauci has said already, I think fall of last year, saying that we're going to be wearing masks until fall 2020. Fall 2021. So really, when we talk about this, we want to make sure that we're continuing that language. Just because you got the vaccine does not mean that we want to forgo all the things that we've done in the year until we reach that stage. So when we think about that, those are two really kind of important things. And then lastly, just having relatable, reputable resources. So everything does change. We've known that since October 2019, which is the first time I had actually heard of COVID in our public health world on a global scale, till today, there has been so many things that we were able to find out from our medical experts and researchers while we were trying to fight this pandemic. And with that, resources change, but it's important to make sure that we're looking at the reputable resources from the CDC, from the NIH, from these trusted medical experts that are making sure that research is done on a wide scale and more population level, rather than instances that happen to one person or 10 people. Unfortunately, when we communicate small outliers sometimes when it comes to vaccines or just the experience with COVID, we create this fear that we all have, and that heightened fear. So someone's vaccine reaction, I think one of the most important things that's coming out right now is like how I feel after my vaccine, right? We need to make sure that we are communicating our own personal journey. I think I surround myself with a lot of public health peeps. So often I see my public health people advocating for the vaccine, but then they're also sharing their actual experience on why they decided. And I think that's really important as we communicate with our coworkers, on our colleagues, why we decided. Even if there is some hesitation there, I think that honest truth of sharing that story is so, so important. And then I'll kind of lead that into, I can tell myself a personal story, but there is so much mistrust within the African American and other minority communities when it comes to healthcare and specifically vaccinations or anything government issued. If we can go back to slavery in the beginning, where African Americans were brought to the United States, post-slavery, we then were utilized for medical experiments. And many of the procedures, many of the medications or early medications and things of that nature were experimented without consent on African Americans in this country. So when we talk about from the beginning, we were utilizing people to experiment for these procedures. So minority communities have a history that's from very, very long ago of why there's distrust within the medical system. And then we can move on even a little further and more closer to date. Most often people hear about the Tuskegee syphilis study. There are 400 men that had syphilis, and penicillin came out as a cure for syphilis, and they were withheld treatment because our U.S. Public Health Service wanted to see what syphilis did long-term in the body. And for 40 years, they lived with syphilis, and we know long-term syphilis can lead to permanent mental and brain damage. And then it also can be passed to congenital with families. And we just saw how the United States literally stood back, and until 1972, when the whistleblowers said that this is happening, this was done. Until 1972 was not that long ago. So when we think about the history of why no one trusts, or predominantly minority communities do not trust, there is valid reason. So this is not like they're all of a sudden don't trust us, and why. There is some really core issues to why specifically Black communities do not trust the healthcare system, and with reason. So when we talk about it, it's so important to identify why. I will just add, I know I have a couple more minutes until we get to Q&A. I'll just add, I have many health professional friends, nurses, doctors as well, and it's so awesome to hear them share their story. And in that story starts with the distrust and mistrust of the healthcare system. Be saying that I was hesitant too, but this is how I educated myself with reputable resources, and I've decided to also take the vaccine. Reasons being, and when we think about minority communities specifically, is that we have done a lot better job of getting trials that have African American and other minority communities a part of them. For years, and this is not just for COVID, for most medications, unfortunately, there is not a great sample size of different minority communities that are a part of these clinical trials. Within COVID, that was done. That was intentional. That was making sure that within these trials, as we try these drugs, to make sure that they're for our whole community and not just a specific population, we have to make sure that we are having minority communities a part of this conversation and a part of the clinical trials to make sure that this medication is right. And then also, I use the African American and Tuskegee experiment as one example, but unfortunately, we do have many others. And I often like to bring up the birth control in Puerto Rico. In Puerto Rico, birth control was actually experimented on pregnant women there. Something that we often still try not to talk about, but the reality is most birth control did stem from those experiments that were done on pregnant women. And now that's why you see, if you do research on the side, or if you have anyone that does, we have so many safeguards to protect individuals from pregnant women, from incarcerated individuals, because we have a history, unfortunately, of not protecting people when it comes to research. So we can't move forward unless we know where we come from. We can't really communicate effectively, in my opinion, without saying, this is where we are, but this is where we're trying to strive to be today. And I think all of those communications are so important to really be able to talk to your colleagues, to really talk, have a, I don't want to say educated, informed conversation about vaccines and vaccine communication and education. But I think it's also important to mention, I'm not sure, often plant or warehouse workers, and I think of them as the frontline workers, often in our grocery stores and things of that nature. I know their communication with the population overall is different, but we think about those populations similarly, and we think about their families, and the same conversations are happening, as I mentioned, where there may be just distrust and mistrust within those. So creating those informed conversations within the hourly and plant warehouse employees is so important. I was just gonna add, maybe bringing one of the construction workers to the conversation may be really, really valuable. When we think about health equity and the decisions being made, even though the construction workers may not be eligible yet, I think it's really important to bring them in that conversation to really have informed decision making and kind of just start that before it's like, okay, now construction workers are eligible, now bring them in. I think it would be really valuable to bring them in early, even if they're not eligible.
Well, I can speak to it from a communications perspective. Great question. And I think that this challenge just really reinforces the value of audience segmentation. And we've been doing audience segmentation for a long time. We all know that our communications are more effective when we can tailor them and make them extremely relevant to our target audience. So if you have specific information for a certain subset of your audience, for a certain subset of your employees, making sure that you are able to directly engage with them with the information that is pertinent to them, versus having a blanket email going out to everyone in which people have to pull the information that matters to them out of it. So this is just, again, a reinforcement of a best practice that we've all likely done, is, making sure that you segment your audiences as much as possible, and really tailor what you're saying to them, what's relevant.
And I'll just add on the global health, if you're referring to your employees in Thailand, I will be honest and say that's going to be a lot more difficult if you're not there to really understand where the trusted voice is, and who is the best to communicate that. I would say your expats in Thailand would know more than you would in the States. So I would seek to kind of have those conversations, or have them get together to have conversations about that, because here we function so differently. In other countries, or in other places, we often see community health workers are a large part. They're the ones administering the vaccines in other places. So there's just many differences about how COVID is communicated, that I would, even though I know it's kind of passing it off to them, they would be most knowledgeable about what's going on there.
So we have a question. It's a broad question for the entire group, and I think I'll try to take this one. The question is, can an employer require employees to get vaccinated? Well, of course, the answer is clear as mud. The answer is yes, maybe, under certain circumstances. So just to break that down a little bit, if you're a private employer and your employees are at will, yes, you can require employees to get vaccinated, so long as you basically follow the rules of the Americans with Disabilities Act. So you can't force an employee who may be pregnant. You can't force an employee who may be under 16 years of age to be vaccinated. But you do have some ability to require, in essence, at will employees to be vaccinated. Now, if you have an organized workforce, if there's a union in your workforce, you've got union rules that you have to deal with, and collaboration. And so I think the short answer, the best answer to this question is that you may be able to do that. You need to decide whether you should do that. And either way, you need to talk to your attorney, because you have to make sure that if you decide to do it or not to do it, that you're communicating it the correct way, and you are following all of the laws that exist in the United States and the state of Ohio, and maybe even in your municipality, as it pertains to what you can require of your employees.
So disinformation obviously makes our jobs so much harder. But I think one of the most important things, especially, and Dr. Hardy touched on this, leaning on the trusted resources, leaning on the experts. We are merely, now for the most part, there are likely some healthcare professionals on this call as well, but from a corporate communications perspective, we are merely messengers. We are not the sources of information. So when it comes time to discuss vaccine communications, when it comes time to, when we've all been writing messaging and instruction on how to follow policies and new mandates for social distancing and disinfecting surfaces and all of that, we always point to the trusted resources. We always point to the CDC. We always point to our experts in the field. And yes, with disinformation, it becomes so much harder. And I know even scrolling in our social feeds, and Dr. Hardy mentioned this, that we have doctors in our social feeds that have no medical background. We have a lot of challenges to overcome. And I think making sure that we stick with facts, making sure we lean on the experts, and making sure that we are consistently keeping those channels of communication open with our employees, because the lack of information can be dangerous. And I think employees just want to know that there's a channel of communication. The information is flowing, and there's a mechanism for two-way conversation. So again, disinformation, it makes our jobs so much harder. But I think relying on our best practices for crisis communications will help us to, just leaning on those will help us get through it, even though it's not making it any easier. Because again, even my social feed, sometimes you just want to turn it off. But honestly, that's another really good source as a communicator to understand what the temperature of the community is. So I have not stopped paying attention to social, and I know a lot of people who have, but because our jobs depend on understanding various perspectives, it's actually a great learning tool to make sure that we understand the mindset of all different perspectives.
I don't have anything to add other than I ditto everything Laura said. I do still stay engaged and I do not comment back, but I think it's so important to know what people are thinking, because personally I live in this world. So I know public health, I understand the disease, I understand all of that, and I have to be mindful that everyone doesn't have that same information. So I have to know what others are thinking.
This is one where if a large corporation came to us and asked for our advice on this, I would ask them to make sure that they had their corporate attorney in the room, that they had their general counsel in the room to be a part of those conversations. Not just because, God bless them, lawyers often start with saying no, but good attorneys will try to understand what the objective is of the business and then try to find a way to get there within the bounds of the law. And so that's my best shot. But Dr. Hardy or Laura, I don't know if you have anything to add.
I was gonna just defer to you. In public health, we use incentives all the time. Incentives to get your flu shot, incentives to take the biometric testing, incentives to be in our research study. But I will say that we have never really, incentives to be a part of clinical trials, right? So there are people that receive the vaccine as a part of that. This is a little bit different. This is new territory. And I really don't have a good answer for this. I'm sorry, Carolyn, and I think who else, and Holly, because I feel the same way. I don't, because of how divisive COVID-19 is, I'm not sure if it will have the same strength that most of the time incentives do. They're just like, I was going to do this anyway. So like, this is nice to have an extra token. I don't know if the vaccine will have a similar feeling. I haven't really heard much of people using vaccines just because of how divisive it's been.
So I do know the first company to step out and do that. I think I saw it just on the news last week. Dollar General had said, we are going to incentivize our employees by giving them maybe 4 hours pay or something like that to get the vaccine. And again, I also think it likely depends on your business. I mean, we know that many of our healthcare professionals, while we're seeing a ton of our friends in healthcare get the vaccine, we also know that we have friends in healthcare who are not getting the vaccine. And it really is dependent on, is having your team vaccinated going to make a difference for your company getting back to work, back to, productivity and all of that. I think, again, it's a very specific challenge that a company has to think of based on their circumstances. And again, as Nick said, legally, Dollar General is doing it, other companies are doing it, but leaning on your legal counsel to make sure that if you're doing it, you're covered. And because there are questions of if we're encouraging it, do we hold liability if someone has an adverse reaction? So there's all kinds of considerations that definitely require legal input before the communications processes even get started to understand what the appropriate approach is.
Interestingly, if a client says that someone has to be vaccinated to enter their facility, you as an employer find yourself in an interesting situation because you're talking now about reassigning employees. And then the difficult question is, what if there's no one that this particularly skilled employee know where they can go? Yeah, that's tricky. And I know that's not a helpful answer to your question, but that is if they're an at-will employee and they refuse to be vaccinated and there's no work for them, then I think the answer to the question is pretty clear. They should be working somewhere else. And that's, of course, a really, really difficult and challenging decision to make. Let's see, from Regina Carswell-Russo, and actually we'd love if Regina might want to join in and share an answer. Regina, as many of you may know, has been deeply, deeply involved in sharing information for the Center for Closing the Health Gap, Cincinnati USA Regional Chamber, and other organizations. And Regina, I will ask you your question if you don't mind responding. So Regina, what language should we avoid if we're trying to encourage employees who are resistant or have mistrust of the system to get the vaccine?
Oh, clever, Nick. Hi, Laura. Hi, everyone. Well, I want to tell you some of the things that kind of we use, but I really wanted to get Dr. Angelica's recommendation on this coming from the health sector and from her, what she feels African Americans and diverse audiences respond to. I will tell you that the number one thing is acknowledging that there is real fear and that there is it's real. The disparity is real. I mean, there's just data and science and everything that goes with that. And just acknowledging that and not being dismissive to it. And also, I find that what is helps to create a pathway to to getting the information. This is my biggest hiccup. People are just afraid and scared. And they're based on all the baggage and trauma and everything that they carry with them. They're not going to receive information until that fear is removed, until they can clearly have a pathway to absorb and create and wrap their arms around information so that they can own it. They can make the decision for themselves. So that's part of the language, giving them the power and the agency to make informed decisions for themselves and their community, because we are community-driven people. So that it's not, I guess, a little less of what I wouldn't say, but kind of what I would say. So Dr. Angelica, would you kind of agree with that, or what would you suggest?
Totally agree. I think not speaking from the consequence mindset, right? Because while we talk about this, we also know it's so important that we see the disparity in who has died from COVID, and we know Black and brown communities have been disproportionately affected. So we don't want to speak from the consequence mindset or like, if you don't get this, you're going to get sick, but we need to empower, we need to provide support and information and education, because the consequence mindset, or you're going to get COVID if you don't get the vaccine, or you're going to get COVID again. So because so many of us have already actually had COVID and thankfully survived, and we're not one of the over 300,000 that have passed away. So just thinking about how to empower those communities, individuals to empower themselves and their families.
I just want to punctuate that, and I just want to applaud you for having this conversation, because it is really, really necessary. It's critical that we reach everyone, and that peer-to-peer is so important, and people will listen to people that they trust. Faith communities, they're some of their doctors, some of the nurses, which is really key, because a lot of nurses they're not getting vaccinated, right? And so the nurses, the doctors, the faith-based communities, and employers, that's their community. That's where they go every single day. So finding the language to be able to talk to these diverse communities in the workplace is really, really important. And maybe even like there's some mentorship, right? Maybe there's peer-to-peer conversations that you have with your employees, and giving them the correct language from doctors so that they can have one-on-one conversations with people to try to move them along.
And I think I would just add as evidenced by the poll earlier, I forget what the number was, but I think we found that like 75% on this call were comfortable with getting it vaccinated as soon as possible. And many on this call are leading communications efforts for our companies or for our clients. And it's important to know that we should avoid groupthink and make sure that while we're trying to develop and direct strategy, we need to have different voices in the mix. So Dr. Hardy mentioned before, bring your plant worker in to make sure that we address communications in a way that makes sense for our audience. When we say, I had mentioned it before, one of my biggest learnings, what we say and what is heard can diverge completely. So making sure that we have diverse perspectives, that we really gauge the temperature of all of the people we are trying to communicate with, and that it's not just senior leadership of a corporation directing the communication strategy. You need to pull information in from all angles.
I'm sorry, I don't have a very clear answer, but I would say as an extra line of defense, I don't know how big your organization is, but contact tracing and having some type of way to know where people are. I know my organization, we have like a code and we know we're in the office because we're not all there at the same time. But if one was to become ill, we'll be very aware of who was in the office that day, how long they were there. We kind of have like a sign in and sign out. Now we're relatively small, but when you do return to work, I know we will continue to have that as a kind of front line of defense, because if someone does fall ill, and at the moment, we have not personally been mandated, even at the American Heart Association level. I think just because we're so different places and access to vaccines is still not widely available. But as an extra line of defense, I would also say if you don't have a contact tracing way already, that might be something even after vaccinations are there to potentially invest in.
So Mandy, I would just add that while I don't have an answer for mandating it to go back to work, from the crisis communications perspective, I would every company should be anticipating that we always do Q&As when we prepare for crises and say, okay, what kind of tough questions are we going to have to face? And you will likely hear from employees who are critical of other employees. What do you mean you're not getting vaccinated? You're putting my health at risk. So I would say, can't help you with the decision of whether or not to make it mandated to come back to the office. But whatever the decision is, making sure that you think through all of the challenges that you're going to encounter, because everyone is going to encounter challenges, whether you mandate it or whether you do not mandate it, and how do you address employees' concerns when these challenges and questions are asked. So I would just say this is going to be an extensive lesson in crisis preparedness, going through this exercise and making sure that you understand what your stance is as a company and how to address the very real concerns from your most important stakeholders, which were your employees.
Advice about communicating with teachers and school employees, even about being in person with students, and that the fear is real and is to shut down any ability to even discuss.
Paul asked the hardest question.
Because first of all, the regulation of these spaces is so diverse. Some are publicly, some are by state, some are by municipality, some are private. And so there's a lot of kind of things in there that would all have to be clarified before even attempting to respond to that question. And as we know, there are about 48 dozen different models in place from school system to school system to school system. And they're all, I believe in my core that all administrators, you're in education because you care about the education of children, and they're trying to do their best. And probably are convinced that the best is an in-person experience, yet are well aware of the challenges, as you mentioned in your comment, Paul, the challenges with that, especially for teachers and for other workers in the school environment. I think there are studies that have shown that it's a less dangerous environment than first thought, but that is very far from saying it is not a dangerous environment. And so I don't know, Dr. Hardy, if you have anything that you'd like to add to that one.
Yeah, this is a very difficult question. I would say when communicating, voicing your concern with data and that reputable information is so important. If the school board is making the decision, if there's a committee, if they're looking to the health department, anywhere you can use your voice, and then rally with other parents to, use their voice as well, I think is so important. I know everyone really wants to get their kids back in school full time, but we know that often kids are the ones that transmit different germs from people to people, and often they are not affected. We've known that there have been less cases of kids really ill with COVID, but that does not mean that it doesn't happen, it doesn't exist, and then they won't be affecting their family members. So I think it's so important to just communicate with the facts, so important to use your voice. I know parents have been integral in really figuring out how to communicate with the school leaders what is best. I think another part, and I'm thinking of a public health lens or public education lens, it's so hard because students come from so many different circumstances, and we can talk about the impact of minority health and all of that. So we have some parents that are the frontline workers that don't have the access to be able to potentially go and help their students at home or their children at home, and they need to go to school. So there's just so many different circumstances, but my biggest advice would be to use your voice, provide the information, write emails, show up at every committee meeting and talk about it. I think those are all really important ways to get done. And I would speak in an empowering way and maybe not in the fear language, right? So I think a lot of it is like, we're all scared. Like the reality is we've been scared for the last 10 months. So speak from a positive voice, speak from an empowering language in order to keep all kids safe and keep kids and their families safe.
Jaquidra, why don't we take it back to you on behalf of Dr. Hardy and Laura. Thanks, everybody. And so Jaquidra, now back to you.
Yes, thank you so much. Thanks, Nick, for moderating. Thank you, Dr. Hardy, for all the wonderful information, very diverse information. And Laura, thanks for the information regarding communications and helping folks get ready for this year. Want to remind everyone that we will be sharing a recording of today's session with you. And also let you know that our next IABC event will be February the 25th, featuring Lori Tingle, talking about effective delegation. So maybe some of what you learned today, you can find out next month how you can get the help you need to make all this extra layered communications possible. We hope that you learned a lot today. I'm pretty sure you did. We also had our special guest come on with Regina, so that was awesome. So again, thank you so much, Dr. Hardy, Laura Phillips, and Nick Vehr. And I put in the chat, if you have any other questions, you can email me at president-cincinnati@iabc.com. Thanks everyone for joining. Have a great day and stay safe.